Good evening, doctors. Myself, Dr. Hemant, and our today's topic is Wilson disease. Today, I am going to explain you what is Wilson disease, what kind of symptoms here, and how to treat this disease. Yes. Now, Wilson disease, it's occur on chromosome number 13. And what was happen here? This is an autosomal recessive disease. Wilson disease is autosomal recessive, and here is a mutation on ATP7B. ATP7B gene mutation. What happens with this mutation? What was going to be happen after this mutation? There is accumulation of increased copper. See, I am going to write about copper accumulation due to genetic disorder in Wilson disease. Why this is happen? Because copper 2 plus converted into apoceruloplasmin. So what happens due to this mutation, ATP7B gene mutation? There is a pathway which blocks the conversion of copper to apoceruloplasmin. And what happens there? The next step there is and then apoceruloplasmin into ceruloplasmin. What was going to be happen? Then if it's the copper not converted into this, so it decreases. Ceruloplasmin levels are decreases, and the copper 2 plus serum copper level also decreases due to this. And I hope pathogenesis is clear for you. Now we are going to discuss about some signs and symptoms of Wilson disease. So I am going to draw a diagram. See, this is a beautiful girl. See, like this. I hope looking beautiful. See here. Yeah, I'm not a good painter, but I try my best to make a painting. See here. See here. This is a girl, and what happens in this? So we are going to symptomatically. It is mainly affect liver. It affect this disease affects mainly the liver. So sign and symptoms. What was going to happen in this liver? Liver, I'm going to write here. LIVER. Liver. It causes chronic active hepatitis. So what was going to be happen in liver after chronic active hepatitis? Cirrhosis. Cirrhosis. Then what was going to be happen? SCC, hepatocellular carcinoma. And what else going to be happen here? There is hepatic encephalopathy in liver. Hepatic encephalopathy. And what was going to be happen here? In hepatic encephalopathy, the patient goes in decrease BT time, bleeding time here decreases, coagulation activity decreases, and confusion occurs due to hepatic encephalopathy. And what else in liver? It causes in liver cirrhosis. I already explained. Hepatitis I already explained. Due to liver there is portal hypertension. So in case of portal hypertension, what happens in portal hypertension? As you know very well, there is ascites, splenomegaly, ascites, esophageal varices. Why this all three symptoms occurs? Because where portal vein located supply the blood to the liver, and this portal vein supply goes in esophageal also. So it in esophageal the pressure increase portal vein, esophageal varices causes, and spleen also its supply comes from. So there is splenomegaly due to pressure. So in hepatic this such kind of situations occur, and these are the symptoms which I told. And here in hepatic it also causes hemolytic anemias. Hemolytic anemias. Why hemolytic anemias? Because it is extracellular hemolytic anemias due to liver is not working properly, due to excess deposition of copper here, cirrhosis occurs. So I hope it till here it's clear for you. And now I'm going to wrap this one. Okay, till liver we discuss a lot. I hope it's sufficient to understand, and it's very easy to crack an examination also due to how about this. And in case of brain, what was going to be happen in brain? If copper accumulation occur more and more, it causes coma, sometimes not always, seizures, tremors, Parkinsonism, bradykinesia. Okay, my dear friends, I hope it's clear. And sometimes it causes dementia. Okay, depression, neuropsychiatric symptoms also came, psychosis, memory loss is dementia. Okay, sometimes subcortical also reason it affects. And I hope you have to understand, and it affects the basal ganglia also. Basal ganglia. So many times they ask, because the accumulation of copper there, that's why it occurs. And there is coma, seizures, ataxia. Ataxia, do you know, my dear friends? Ataxia means a person walk like a drunk man. It's a movement disorder due to brain disturbances. So you have to remember what kind of symptoms in brain. And in heart, our lovely heart, a girl, lovely heart, going to be big. Here the heart. And last causes cardiomyopathy. Cardiomyopathy on heart. Cardiomyopathy. And what was going to be happen with eyes? A beautiful eye, a girl, beautiful eye, going to became a ring, Kesher-Fleschner ring, a brown color ring in eye. In a girl eye, there is a brown color ring, and it causes the Kesher-Fleschner ring. Kesher, K-A-Y, Kesher-Fleschner, F-E-L-C-H, Schner ring. Kesher-Fleschner ring. Kesher-Fleschner rings of cornea. On cornea, this is known as the symptom, eye symptom. See this beautiful girl. I hope I draw very well. Sorry, my dear friends. And it causes in kidney, see, kidney located in the back side. Kidneys, the girl kidney, both kidney. In kidney, it causes renal tubular acidosis type 2. RTA, renal tubular acidosis type 2 in case of Wilson disease. And what happens? There is a bicarbonate handling failure, disorder of bicarbonate by PCT. Disorder of bicarbonate handling. Okay, my dear friends, still here it's clear. And due to this, amino aciduria occur. Amino acid loss in urine, amino aciduria occurs. And what else going to be happen? There is a nephrocalcinosis and weakening of bones, joints. And in case of hormones, if you are going to remember, I hope in hormones it causes hypoparathyroidism. Hypoparathyroidism, decreased level of calcium. My dear friends, till signs and symptoms about the definition of Wilson disease and pathogenesis we already cleared. It's very easy. If you think with a brain, you have to use some logic. What was going to be happen when copper accumulates in our body? Okay, why this happened? Due to ATP 7B gene mutation, chromosome number 13. Okay, now I'm going to ask what kind of, I forgot one thing to explain you, and I hope Dr. Emily will answer. My question is, what kind of cataract we are going to find in Wilson disease? Dr. Emily, please answer.
Sunflower.
What an excellent answer. I really appreciate his performance. Well done, guy. Is absolutely perfect. Sunflower cataract seen in Wilson disease. Never forgot. So many times they ask question, what kind of cataract? One ophthalmology question you're preparing here. I'm just, brilliant. Very well done. Now we are going to discuss about laboratory data. What we are going to find. If in liver, it causes cirrhosis, acute hepatitis, encephalopathy. So, diagnosis by there is LFT. It is increased LFT functions or decreased? Dr. Emily, answer?
Increase.
He is absolutely right. All LFT increases. Example like SGOT, SGPT. These are rise. Serum bilirubin, direct, indirect bilirubin. All are rise due to Wilson disease. Absolutely well done. And my serum ceruloplasmin level, it is 20 milligram per deciliter is normal. My question, it is going to goes down or increase? Dr. Lal Singh, answer.
Cropper.
It is increase or decrease?
Cropper.
Increase or decrease? Dr. Emily, please answer. Yeah, he is absolutely right. Decreases. Yes. Why decreases? Because copper convert into ceruloplasmin, and due to this gene ATP7B, there is a blockage occurs. So copper not going to be converted to ceruloplasmin. So serum ceruloplasmin level goes down. In pathology, I already explained. Okay, no problem. So here it must be less than 20 milligram per deciliter ceruloplasmin. And in urine, what we are going to find? Amino aciduria. I already explained 24-hour urine copper. Also, we can advise 24-hour urine copper. It also increases. So, my dear friends, it's really clear for you. I try my best to explain you. And what is the gold standard? Gold standard is liver biopsy. Liver biopsy is the gold standard where we are going to find out everything, and it's really helpful for us. We can go for MRI also, but MRI is not a gold standard for brain pathologies. And how we are going to treatment according to the new recommendation, new guidelines. Never go for drugs, never go for jump toward drugs. Firstly, you have to educate a patient what kind of diet he is going to avoid. Like copper diet rich, you have to avoid like mushrooms. Avoid mushrooms. Avoid chocolates. These are the copper rich food, and we need to avoid dried fruits like almonds. Okay. And many others like shellfish. No need to eat shellfish. These all contain copper accumulation more here. So nuts you have to avoid, like ground nuts, and these nuts you have to avoid. And how we are going to treat? Yes, Dr. Lal Singh, you wanna answer how to treat? No, he poor performance today. Yes, Dr. Emily, you want to answer? Yes. What brilliant answer. Zinc we are going to use in initial therapy. Zinc acetate. Yes, he's absolutely right. He is really working hard, and nowadays his performance rising, I am sure. And what else? Penicillamine we can use. And what else we are going to use? Other drugs also. Tarantine. We can going to use such drugs. I hope you'll hear about Wilson disease. I'm sure if some question will came from Wilson disease, they are like to ask from these also. These maybe they can ask anything, but most questions last years or maybe in coming, they like to ask some basics and basic knowledge. Basics always they like to ask. So my dear friends, I hope if you watch this video and you have to remember everything which I taught you, so you are going to get a very excellent knowledge and you can crack any examination. You can solve easily any question from Wilson disease. Okay, my dear friends, have a good day. And if you still not subscribe my channel, so don't forget to subscribe it. Please subscribe my channel, and if you have any comments, if you have any queries, you can write me on a comment box and ask me a question. I'm always ready to answer you. Have a good day. Good night, my dear friend. Thank you.